Thank you for tuning in to the Healthy Project podcast, My City, My Health series. Don't forget, tickets are now available for the My City, My Health Des Moines. Visit mycity.health to register and join us for an inspiring and informative event. A big thank you to our presenting sponsor, Unity Point Health, for their continued support. Thanks for tuning in to the Healthy Project podcast, My City, My Health series. I am your host for this year, Brooklyn Lowry, and I am joined today by Jazzmine Brooks. Woo! Jazzmine, why don't you give us a little introduction about yourself?
Oh man, where do I start? I am a certified doula here in Central Iowa. I provide a lot of various supports as well as really attending births, doing childbirth ed classes. I do a bit of yoga in the community, as well as consult and do speaking engagements about Black maternal and infant mortality, equity and wellness, and all those other things. My full-time job is in food security work. So I work for Iowa Healthiest State Initiative to bring more fresh fruits and vegetables to Iowans across the state through the Double Up Food Bucks program. So lots and lots of things on my plate.
Okay, yeah. Do you want to
Mhm.
touch more on what Jai Olive Wellness is? And correct me
Yeah,
if I'm wrong.
J Olive Wellness. So I moved to Iowa and got married. And of course, part of the conversation is, are you having kids? And when are you having kids? And we were like, pump your brakes. We want to go back to school and all these other things before we start talking about children. But it gave me a chance to, if anything, talk through mental health because growing up in Southside Chicago, I call Las Vegas, Nevada home. I'm now stuck in this very rural white place of Iowa, and really having to navigate resources and just overall healthcare needs, knowing that I don't have access to people who look like me. I didn't know where we went and what was making sense. So J Olive Wellness started as a podcast just like this, where I shared my experiences navigating mental health and other healthcare resources, the relationships that were changed, just really wanted to give perspective as I felt like that type of voice was not out there at the time that I could find.
Mhm.
And I ended up getting connected with, at my job, I was working at Iowa State at the time and found out about the Black maternal mortality. And something just inside of me, based off of where I was in that time of my life, I cut all my hair off and went down to Atlanta to get trained as a doula. And the hair part I bring up because it was just this
We all
reckoning.
go through that.
Right, reckoning as a Black, I was already natural, but I think I needed that push, right?
Mhm.
So I went down there, got gathered all the way up by all these beautiful Black women that I still hold dear to me, and came back and was like, I'm about to do this. And I don't have no kids. Like, what does this look like? So Jala Wellness is now a nonprofit, I can say that. And so really trying to increase access to resources, direct services to families. I'll be sharing about our mobile clinic because we'll be up and running by the time My City, My Health will be. And so, yeah, I'm just excited for the growth and just the opportunity to bring more resources to my community.
Yeah.
Mhm.
First of all, I love that you mentioned cutting all your hair off because, like I said, we do all go through that. And
It's
I
okay.
recently just I didn't shave it, but I did cut a good amount of it off, but I wasn't
It was gone. All of it
yeah.
was gone. Hair follicles looking like Jada Pickett Smith out here. Like it was gone.
Oh my goodness. Well, I'm happy that you were able to, from that, also have that be in your journey and build a
Mhm,
amazing group of Black women with you. That's awesome. I'm
mhm.
sure your journey has, or just your outlook on it, mental health wise and Black maternal wise, has changed from before you had kids
Mhm.
to now. So,
Yeah.
how has that changed?
Yeah. So I actually miscarried. So I would say I'm a mom to an angel baby. But I would say even just in the past year, it's changed. I walked in with this complex that I didn't really realize was, forming of
Mhm.
I need to be out here saving people. I think, they talk to you about that, and particularly in Black doula training. I felt like I didn't get that in other doula trainings, but when there was a Black woman facilitating it, she talked about how this work, if you do it right, it puts a mirror up to who you are, and you have to reckon with whatever is looking back at you. And I would say, I've had a lot of great birthing experiences and I've had a lot of challenging birthing experiences. But what I do leave with is this understanding of how we show up for mothers, particularly Black birthing people, how we show up for them in the boardroom, in policy spaces, in direct services. I've been fortunate to help train other doulas, mentor other doulas, and so that's changed my perspective about how do I equip them to support families. My language has changed, right?
Mhm.
How how I communicate the work has changed. And then, now having the experience of a pregnancy loss, it gives me a newfound respect for like the ways in which Black women, particularly in rural places, particularly the places that are underserved, that are low in access to clinical preventative care, really shows us the work we still have to do. We've come a long way, but I would say that in some ways I feel we're regressing.
Mhm.
Um, and having those direct experiences impact the way that I show up today for sure.
Mhm. So that's a very sensitive topic to talk about,
Mhm,
and I'm
mhm.
very sorry for your loss. I think that if
Mm.
there's at any point, if you're not comfortable talking about
Yeah,
that, you can
I'm good
let
now.
me know.
I
But I think that, um, we don't talk about how Black women are inversely affected by
Mm,
miscarriage, and
mhm,
I think that I'm curious as to what those services looked like for you, how you were
mm,
able to access them,
mhm,
if they could be better, what
mhm,
could be better?
mm. So let me know if I get too political. I try not to. But I feel the abortion conversation shows up very uniquely in our experience. I think we are missing out on a big chunk of what resources look like when we are cutting out abortion access. When this conversation became eroded with the craziness that it is right now was the time that I found out I was miscarrying, but I had not miscarried. And
Okay.
so I had to make a decision, or was left with the only decision if I did not formally miscarry, that I would have to leave the state in order to get the services I needed because they would not be here.
Mhm.
And that was the scariest, most craziest conversation to have with yourself of like, you're telling me if I go to the doctor right now and my baby has not left my body, that you would not be able to do anything for me. And I could potentially die because now a fetus is demised. So it's like, what do you do? What do you do? And I had nowhere to go. I I miscarried at home. A doula, the rural Black doula, miscarried at home because I did not feel safe going to the hospital. I did not feel like I was going to be treated with care. As far as knowing the resources, a lot of it was my own network of community, and that is the heartbeat of the work, right? Is we think healthcare is it? Yeah, healthcare can definitely be way better at providing services. And also, we need to reconcile with how have we completely tore down networks and communities of support for Black women. Because if I didn't have the people that I had around me, I probably would not be well today. knowing that I was already in counseling, so I had that support. I can reason with the fact that if finding a counselor is very difficult, let
Mhm.
alone a counselor equipped to talk through fertility loss. Um, I would say family, people just being so unaware of like what that experience is like. Even in pregnancy, the conversations people have, you're just an incubator, right? Like it was less about how are you doing, but how's the baby? And in the way it just helps build up this complex that you don't matter. And it's like, whoa, wait a minute. And so when we're talking about access to resources, what questions are we asking the families? How are they feeling? Not noting things on the documentation that will create challenges for them later. That was another thing. Like my fertility clinic, my first one had noted my a mental health, observation that they had. And so I had to have a conversation with them about that is not your job and you are not formally equipped to even comment on that. And that's not even what anxiety was for me. That was me having breathing patterns to help calm me down because you're so rough,
Mhm.
right? And so my big thing now that encouraged me to start looking at what postpartum care even means. Cause like we got all these birth doulas out here and we don't have enough, clearly. But then what are we doing postpartum for parents? And that was the biggest journey I had. I had postpartum depression, even infertility loss. We don't talk about that either. Like how your body is still acting as if it carried a baby. So what does that feel like for Black women, specifically women of color too? Like the stigma around that. And so having to carry that weight, I'll be honest with you, I'm in a privileged position. I was able to go home, I was able to travel, I was able to get myself together and use everything at my disposal. So I'll be honest, if somebody didn't have anything that I had, I would imagine they would have had a very rough time and continue to have a rough time because they did not have the support, the anchor that they needed to be able to feel the love and care to get back to a new part of who they would be knowing that this loss happened. Because the thing is, do I go back to who I was? And that's a stigma too. It's like, no, I am now a whole new person. And how do I even get to know this person after
Yeah.
this happened? Mhm.
Yeah. So to me, it's like maternal care is the umbrella, and there's
Mhm.
so much more than that. It's pre,
Mhm.
post, mom, baby, healthcare, s beyond services than just that than
Mhm.
just that small generalization, which is crazy because it just shows how much we lack as a healthcare system and so much more beyond that. And
Mhm.
I do wanna say, don't ever apologize for wanting to be too political because this is your personal journey. And I think that when you share your personal
Yeah,
journey unapologetically, that it's you and
that
no
is
one
true.
no one can tell you otherwise. This is
That's
what you
that.
experience.
I mean, our Black women our politics are not separate from our identities, to be honest. And so
Yeah.
there's no way for me to speak about it without a political side for sure.
Yeah. Yeah.
Mhm.
And especially after what you've gone through because of what you had to
Mhm.
experience and how the laws in place really affected your journey, it's understandable
Mhm.
why this would be also important to touch on. And I can't imagine your mental health going through this. Oh my goodness.
Mhm.
Yeah,
Yeah,
I'm
dark day. Dark. Mhm.
yes. How were mental health services looking for you and like how did you
Mhm.
how do I ask this? Lean into your community. Was that a thing? Like leaning more into your community to kind of focus on your mental health.
That's a great question. I would say the beginning, it was isolating. Like I had to isolate. I felt like no one understood. No one could comprehend or reason with what I was going through and how it felt. I think everyone wants to approach this as positive and affirming and that you'll be okay, but you don't really hear that. You're not digesting that. Like, it's a loss, a significant loss, regardless if it's, early or later. Like, I felt it. And I think that's the piece of it too, is that spiritual attuning that I have to my body, is that I felt it and I knew before I even got the test results. And I wasn't even like concerned or worried. I had a very positive outlook, was very excited and just looking forward to, doing all the things to prepare, right? And so I can't remember when, but I ended up the first time I was able to even like open up was when I took a trip for a week by myself. And I'd done that in the past, but like to truly just be with myself intentionally. I think that's the key part, intentionally. To just spend time with me again. I did not let my husband in for some time. My counselor, I have a great counselor. I've had a relationship with her for the past 5 or so years, and so sitting with her was great. I ended up getting a second counselor to specifically go through like our changes and challenges as a married couple. I think people don't know how to navigate mental health resources. I do recognize that for sure, because when folks ask me like, how do I decide on a mental health counselor? I'm like, it's not just that. It's like, what are they doing with you? And what I didn't want was to be going in there crying all the time, complaining, like it's not serving me. I feel like a weight is not lifting. I feel like I'm not getting clarity. You're not giving me homework. And so thankfully I had a counselor that did all those things for me. She gave me perspective. She helped me anchor myself in more tools for clarity. There are books that I read. I'm reading a book right now called Courage to be Disliked, because I didn't realize how much wrapped up I was in all these other things that I thought mattered at the time, that to me today do not matter. I was like, am I worried about this stuff? And this is holding me down too? And I'm like, my baby taught me so much about myself, so much that I, back then, I would say, oh my God, I can't breathe, to you gave me a new breath. Like, I'm breathing a new type of air, and I'm so deserving of that. And will love the next attempt and hopefully birth of a child, right? But it's like, even in those moments, you're just like, I can't do this again. Like, what does this mean if we get further? Like, all these things go through your mind, and people just don't understand. Like, you can be present all day, you can show up, you can be gracious, like you can be patient. But man, those lashing out moments, I mean, duck and hide. Like,
Yeah.
I didn't even want to take care of my plants. Like, that's how bad my babies, my babies. I had dogs. I wouldn't got another dog. Who does that? But like, I wanted to take care of something, so I went
Yeah.
and got a corgi. Don't do that. Like,
Yeah.
I love Bree, but I'm like, man, I got her out of pain, and
Yeah.
now
Um, she's
I love
lovely.
I love her. She's my shadow, which is such a godsend, because she's my little protector now. I have my older dog who's my protector, but she's my fierce protector. Like, everybody got catch hands if you mess with mommy. So I just like, that protection was fun and exciting to bring in the house, but I think sometimes I think about how unprotected I am. And in, that moment, it was like, man, I've had these traumatic experiences in my life, but that was like, I mean, the epicenter of unprotected that I felt. And it was
Yeah.
like, what do you do now? So,
Mhm.
mhm.
Yeah. I mean, you bring such a different
perspective to the table, I feel like, because we also talk so much about leaning into people, which is one aspect that is so important. But I think it's also important to note that when you go through such a hardship, that at the end of the day, a lot of it is just stuff you experience yourself. And
Mhm.
no one is able to reach into your brain and fully understand what it is that you go through. And so just having those services to at least help you navigate the rest of your personal journey is very important. And
Mhm.
I appreciate you so much for sharing that with us.
Yeah.
Um, were you certified as a doula and a lactation specialist
Mhm.
before or after you had experienced this?
It's way before, way before. So
Okay.
this happened last year, but I've been a doula for 6 years in August.
Mhm.
So,
So do
yeah.
you think that the education and, like, understanding or knowledge in that realm also, changed how you navigated?
Mhm. I mean, making that decision to stay home, that was the decision for my partner and I, right? Like,
Mhm.
I knew I had and I would say he's a doula too, right? Because 'Cause he's been with all my clients when we particularly during COVID when it was like we couldn't be at nobody house. So, even him, like, paying attention to certain things and me already sharing with him, like, this is when you would wanna call an ambulance if, like, this happens, like, being very aware and educated about the process and the practice huge because I am a fertility doula as well. So I am trained to teach like reproductive health and sexual health. So it's just
Mhm.
like I already know my body enough, like like more than most people. And
Yeah,
so I'm aware of, like, what shouldn't be happening. I knew what to drink, I knew what to eat to recover, I knew that's why I went vegan for 4 months. So after I miscarried, I went vegan for 4 months just to really help re-regulate my body into a
right,
state of being that allowed me to be open. Because if I had been eating poorly, I probably wouldn't have survived. Like, food is, like, our home state. Like, if we're able to put things into our body to help us, it
yeah,
really helps provide that anchor. So, I already knew, like, what I needed to be doing. Now, was it easy every day? No. I think people think doulas can doula themselves. No. It's not as easy as it sounds, like,
mhm,
because you have your moments where, "I'm not about to do this. I'm not about to do this." And I would say, because it's calling me right now to say, when using services, I think people need to be grateful. Like, I was always met with, "Well, at least you have," or "I'm giving you this. Why is that not enough?" And it's like, that's nothing to do with you. If I
yeah,
use that resource or that idea or eat that food or do this, like, provide this to me and then hands off, right? Because it is overwhelming. You're overloaded with things, and then you want me to hear you and listen to you and give me all these things, and I need to reconcile that and put whatever I got to the side that's going on for that moment or that day to, like, listen to you and do what you say, and it's like, that's not possible.
yeah,
Like, any type of resource in any scenario can be overloading to people. And so I wish folks would have said, "What do you need right now? Like, in this moment, what would get you to a place where you could feel comfortable sitting still, um, or taking advantage of this service? What's prohibiting you from doing X, Y, and Z?" Um, yeah, I was just like, I these are all the things I can do. Now then what's the first thing I do versus what's the next thing or the fifth thing? Like, it is overloading sometimes. And so, but thankfully, like, for me and my experience, I was able to know, like, take this step by step, let your body recover, then go to the next thing, whatever that next thing that is pulling you. Um, and so I think I'm finally able to not cry just thinking about my kid, right? Like, that I can just be open to just feeling their spirit as I continue to move through this work. Um, but I would say back then it was like, for now, I can't do anything and I shouldn't
Mhm.
do anything. Like I stopped school. It was a lot. I had to stop and sit still, and that was not easy.
Yeah.
Mhm.
So, staying on the topic of you being a doula,
Mhm, mhm.
what Black maternal issues have you sought to impact the most? And can you kind of share your, excuse me, can you kind of share your successes within that?
Yeah, I would say increasing the presence of Black doulas in the state. I initially started with a few Black doulas. We were all kind of in different counties. And since then, increasing the presence of different trainings, I thought was a challenge to only be trained by a certain body, particularly a body that did not like highlight or respect Black maternal mortality in the first place. And so being trained by Black midwives, like all my training has been by a Black midwife. I was like, this is important. And so since then, we've increased, and I can only speak for Polk County, which where I serve as the liaison for having more Black doulas be present. Also started a doula program that serves migrant, immigrant refugee families. And having that dual lingual, like multilingual language, like opportunity for families that may not have access to doulas. So not just serving Black families, but serving families in general that have the most displacement or, resettling here after coming from a place of conflict. These people are vulnerable as well. And so that's what Black women do, right? Is like we do what we do for ourselves, and then we start to have these other anchoring points, these other communities. And so that's been the biggest piece of just increasing that presence of doulas that speak multiple language. Because again, Blackness is also not monolithic. I've served Black identifying families that speak Spanish or their families speak Spanish, right? So it's really thinking about like what other things could we be doing to help bring more families in. We've also I provided childbirth education for free for families that speak multiple languages, including Black families. So we call it Black and Birthy. So that's been going for the past 2 years. I can say, I don't know if it's too much, but I got a grant to expand that to the community, to work with community service, providers that are in the Asian Pacific Islander community and the Latinx community and refugee community. Like, how can we expand this um, education of childbirth ed to families? And then also really helping to engage people around postpartum. What was nice about the doulas we just recently trained is they're trained not only in birth, but in postpartum. So we combined everything together so that they have the entire experience in one. So that was a week-long training that we provided. And I think it set them up for success for sure because I do see a uniqueness in how they show up, and how they look at it from a business mindset. Because I always talk about like doulas, it isn't just about providing the families, but this is an economic benefit, right? You are not only providing education to the families in those communities, but you are creating an entrepreneur that can help recycle the dollar in their community, right? By providing direct services, we're also training the people in those communities to do the work. We're not trying to infiltrate, bring random people in that don't live there, that they don't know. Like it again, it's doing the work of training people within those communities, provide those services and giving them the support. So part of my job is also to provide professional development. So we meet regularly through doula huddles to talk about different concepts, to help them engage around different things. So we talked about gestational diabetes. They got a big training on preeclampsia. We gave them cuffs to do blood pressure, right? Like all those things I've had to, I wouldn't say the word fight for, but it really was about engaging the state and the service providers to know, like, it isn't just about me helping someone deliver a baby, but there's all these other pieces to it, and really helping to like situate what doula work is. Because it's always about like what doula work isn't. Well, you can't catch a baby, you can't do this, you can't do this. I do so many other things that matter that has shown impact in the health outcomes of families and children.
Yeah.
Mhm.
And I think people look for people that look like them.
Mhm.
So
Mhm.
it's so important to serve as more representation for um, underrepresented underrepresented communities,
Mhm. Mhm.
and even going into the community level and not
Mhm.
infiltrating. I like that you used that term, but educating the people already there to then further spread
Mhm.
those resources and that education
Mhm.
is
Mhm.
amazing.
Mhm.
Um, and just moving on from that, looking at the conference that you'll be joining us for. In the Black maternal health panel, what specific issues are you hoping to be able to touch on?
Yeah, I think there definitely needs to be some conversation about the postpartum expansion, and kind of how that impacts the work that we're doing and how we're showing up. I think posing the question to the community, the attendees about where do they see themselves in this work? I mean, we've been talking about Black maternal mortality in the state, I would say, since COVID. And so have they seen progress?
Mhm,
Um, and then asking the next hard question is, do you feel the community feels that progress? Right?
mhm,
Um, because I think there's a lot of protective mechanisms that hospitals do because now it's like, let's reduce the risk of getting sued. And that's the easy route, right? I would say keeping lawsuits down. But we go back to not just the health outcomes, but the experience of birth. I think we misrepresent addressing Black maternal mortality when we just reduce it to health outcomes.
mhm,
So with asking these survey questions, these are great, but I also want to know, how is this person experiencing their pregnancy, their
yeah,
birth, when they go to the hospital to do their, prenatal appointments, when they get any exams, when they are looking for resources, referrals, when they're getting case management services. I want to know, do they know what those experiences look and feel like? And are they getting the help that they need? Um, and I think too, as we think about continued community engagement, baby showers, and those types of things, I think those things are great. The question is, why does someone need a stroller? Why don't they just have one? And what barrier is causing that? We need to look at jobs, right?
mhm,
Payment options, people being able to afford things. Groceries are high, they're high. Formula, Pampers, diapers,
period.
wipes, everything is expensive. And so part of that access is to really look at all the other pieces that are, really creating more pressure for a family to just be able to be a family.
Mhm,
And it's hard, right? Because like the conversation is around healthcare, and I'm here for that. And also, what I'm realizing too is these families don't have access to healthy, foods, which is a huge impact to not only reproductive health, their pregnancy, but their postpartum too. Like food matters. Having a safe place to live matters. Having a healthy relationship matters. Being able to afford childcare matters, right? I can sit here and be a doula all day, but guess what? My conversations with my families, I barely can get a conversation in about stages of labor these days. I'm having to talk with families about substance abuse, about how can they afford to stay home because they can't afford childcare, they can't find adequate childcare. I'm having to address all these other things. So as much as being a doula is great, we really having conversations with our family, it is barely sometimes about delivery.
Yeah.
And that's
Yeah. And it's so much more than just numbers beyond
Mhm.
the healthcare sense. And I
Mhm.
think that that's really important to touch on. And you just using your voice has already and will already make such an impact. Because me not being as educated in that realm, it means a lot, and it goes so much further when you express knowledge like this, because it's not talked about, and that's why a lot of people, including myself, don't know that it's so much more beyond that.
Mhm.
How do you think organizations and people like myself can get more involved in initiatives focused on just the entirety of maternal health?
Yeah. I'll be honest, I'll say the honest, I will always be honest. We love recreating stuff because it makes us look good. And if that is how people approach it, then you shouldn't do it. That's how I truly feel. There is enough programs out here that are currently serving families that have doula projects. We don't need 1,000 doula projects. We
Mm.
don't, right? But how can you currently use the doulas that are present in this community that have been working hard to build relationships? They are paid to do outreach, so they're already engaged in so many different ways. How can you maximize their relationship building and uplift their work by donating to covering families, services to families? A lot of families don't qualify for some of these programs, and I think we miss out on a big chunk of community members that are allowing to have doulas. Like doula care is still not accessible or affordable to people. And so how are you building programs that allow for doulas to be paid for their time, offering childbirth ed classes, offering doula support, offering time for doulas to come in to share about what they do and how they can serve communities, educating people on what doulas even do in the first place and why they exist. I think is so vital and important because it helps us knock down those walls that prohibit us from coming into certain spaces, because doula work is not translatable in a lot of different communities. They call them different things. They are seen differently. In a lot of indigenous communities, Latinx communities, we're looked at as midwives, right? So like, but I'm not a midwife in this country. I have to have formal degrees and those types of things. So really helping to anchor what opportunities are for doulas. I think the other piece I would say is teaching people advocacy and empowerment. Like how can they help in navigating their resources? Don't just hand them a piece of paper and just hope that they go and look at their doctor's notes. Like really talk to people about their results, talk to people about the next step or next phase of their care,
Mhm.
posing questions to them if they don't have questions, and really, again, helping to build agency. We cannot do this work if people don't feel comfortable and confident, standing up for themselves, declining certain things, asking questions. I think that's the big part of our job as doulas, is helping to prep people for their appointments. And I think it shows a different level of like how they show up for themselves when they feel confident. Because then I see how they show that up for their child once they're done with me, right? They're like, yeah, my doctor was holding my baby a certain way, and normally my mom was like, oh, let it go, and I was like, no, I don't want to let it go. Or my blood pressure was continuing to be high, and then I kept like fighting for it and found out I had post preeclampsia. Like that's so important to the work, is not only providing this support for doulas, but also in just people feeling confident in their own health and taking ownership of their health for sure.
Yeah, and being vocal about it too.
Mhm.
Yeah. Um, So just uplifting the organizations and the resources that are already here for
Mhm.
our benefit so that they
Mhm.
can get more outreach rather than creating the same duplicate organizations with the same amount of outreach.
Doula projects are intense. They require a lot of time, a lot of personnel, a lot of mentoring. And I think for particularly every step, we have found a smooth, like, way of managing it. Like, we have a ton of doulas, and so it's not easy providing the level of support that we have created. And because we've already been doing this for 5 or so years, it's like, yeah, let's not reinvent the wheel here. Like, let's use the doulas that are there because they are, people don't know, but like, they are private doulas. They're not just beholden to every step. Like,
Yeah.
I'm a doula with Molina, right? And I take my own private clients as well. So we have the ability to work in different programs. There's YWRC that has a doula project. So really helping to, support some of these projects that are currently supporting the community and surrounding counties. Like, let's do that for sure.
Hmm. Yeah.
Mm.
Well, thank you so much, Jazzmine, for your time. Is there
Absolutely.
anything else that you would like to touch on before we see you at the conference?
Yeah, no, I'm just excited. I think, this will be a great opportunity for people to engage, 4 years later about a really important continuing evolving discussion around how do we show up? How have people shown up already? What ways do we still need to work to rebuild towards a better perinatal healthcare system that sees all and supports all in
Yeah.
an equitable way? And I think that is where we need to land with this, separating the ego, separating the, oh, well, we need this type of money in this place. Like, let's have some truthful conversations about where are we at and where we need to be going.
Well, thank you so much, Jazzmine, for your time. And I am excited to see you at the My City, My Health conference.
Thank you. Thank you. Thank you.
And thank you